Okay. And what is this? This is a clavicle, isn't it? First rib, second rib, isn't it? In the left side, upper border of the costal cartilage, half inch from the sternal line. Okay, mark here 1 point, isn't it? Here, approximately here, half centimeter from the sternal margin, isn't it? Make a point here, isn't it? In right side, on the third intercostal cartilage, isn't it? Lower border. So here it is the lower border in the left side. So at the third costal cartilage, upper border, again half centimeter or half inch or 1.3 centimeter. Half inch you can. Okay. Here make a point joining between these 2 points. This is a superior border, isn't it? And similarly from in the left side, so this second, third, fourth, fifth, sixth. Okay. And here at the sixth costal cartilage and 2 centimeter from the sternal border. Make a point here. Okay. And here at the fifth intercostal space, 9 centimeter from the mid-sternal line, 9 centimeter mid-sternal line. Make a point here. Joining these 2 points, it is a inferior border, isn't it? So here superior point and the inferior point, isn't it? Line joining these, which should be concave, which should be convex. Okay, like this. Line joining these 2 points. So this is a right border of the heart. At the fifth intercostal space, okay, fifth intercostal space and to this point, which should be convex again, isn't it? Like this, line joining these 2 points. So this is a left border. Left border. So this is a surface marking I am telling. Like this you have to. So right border, left border, inferior border and the superior border. Similarly, here the right border, isn't it? Left border, inferior border, okay, and the superior border here, isn't it? The great vessels are there, no? Here, superior border. This is about the borders of the heart. Is it clear now?
Yes.
About the border? Okay. And it is having the 4 chambers, 2 atria and 2 ventricle, isn't it? So atrium, these receives, right atrium receives the deoxygenated blood, whereas left atrium receives oxygenated blood, isn't it? And about the 2 ventricle, there is a right and left ventricles, isn't it? Right and left ventricles. And apart from this, heart is having the valves, 2 sets of valves, isn't it? So one is semilunar valves and next is AV valve. Semilunar valve and AV valve, 2 sets. So in the AV valve, between the right atrium and the right ventricle, there is a tricuspid valve. Between the right atrium and the right ventricle, right AV valve or tricuspid valve, isn't it? And in between the left atrium and the left ventricle, there is a valve, isn't it? Bicuspid valve, isn't it? AV valve or left atrioventricular valve or mitral valve, isn't it? Mitral or bicuspid or left atrioventricular valves. And next, so these are 2 sets of valves, isn't it? Next is semilunar valves. 2 sets of semilunar valve. So at the beginning of the pulmonary trunk and beginning of the aorta. Okay, there are semilunar valves. So name itself it is indicated semi-lunar means half moon, isn't it?
Yeah.
Three are there.